It's a strange bird, I guess, in a way, to realize, you think you're healthy and all of a sudden you're not.
It was last year, and it was a shock.
He said, I'm 99.9% sure that it's cancer. Whether we can save you or not, that remains to be seen.
He said, really, regardless of which way we go, we're going to have to take Revlimid. But they also have these clinical trials where you could take a couple of other drugs that they're not sure which one is going to be better ultimately.
Clinical trials are the way we answer important questions in cancer, and that's the reason people are living longer and doing better, and the way we're discovering new drugs.
It's typically standard of care plus or minus a different drug to see if that drug is going to make their cancer behave better or shrink faster, or be cured better.
Cancer research trials are typically put together by a team of national experts. They are vetted at many levels before they're going to get supported by the National Cancer Institute or have federal dollars put behind them.
The trials offer the standard of care plus the chance of doing something even better than the standard of care. And so it gives our patients the opportunity to have better outcomes.
There is no pressure to participate in a clinical trial. They have their choice, and it's an option. And not all places have that option of clinical trials.
We want it to all be meaningful. We don't want patients to waste their time going on a protocol or dollars to be wasted by going on a protocol. So each of the trials are designed so that they're very unique, that a team is looking at to decide, are you the best patient for that protocol?
My age bracket was 80 to 90. Normally they don't have people that age that are in good health. So I happened to be in the right age bracket and my health was good. I just said, well, if I could help somebody, I'd be glad to do that.
It was like you can go without the clinical trial at all or either of the two arms of the clinical trial, and they ultimately seem to be giving me the same kind of benefit. And so why not? I'm happy to go ahead and participate.
They really talk you through it, and they always hold your hand and give you strength to keep going. They care about you as an individual, not because you got cancer. They care about you and your personality and your body.
You're dealing with this kind of a disease, you've got to give yourself permission to be selfish and say, okay, what can I do to help me? If I can contribute to something good happening down the road as a result, then, all the better.
My concern was, how does the little children do it? How do they do this? And so to think that you could have something to help them.
I say it would be a good idea and you help somebody else.
I wanted women out there to know that there's help and there's people willing to stand by you. I don't know what I would have done without them.
They are not just a patient. They are participating in research. Regardless of how the trial turns out, it will help them. It will help us understand the science better.
Before we were just doing therapy trials for cancers, now we're looking more at symptom management, quality of life endpoints, things that are really important to people. Anti-nausea drugs are better, our anti-infection drugs are better.
And the reason that these drugs are coming around are clinical trials. They've been tested in clinical trials by patients who have opted to enroll in these trials so that we can have new advances in cancer care.
We have to be ethical in this process so that we're not going to be treating somebody with brand new drugs or brand new processes without good evidence-based data. The majority of the research protocols that are sponsored through the National Cancer Institute are available right here in Springfield. Just ask.